My role is one where I work very much like the GP. I see patients who have not been diagnosed with any conditions, so acute illnesses, chronic diseases, and then I manage them in the same way as a GP would. I can refer on to secondary care or as an emergency admission. I prescribe, and yes, I do pretty much the same work as a GP. I started my work in primary care as a practice nurse, doing chronic disease management, sexual health, contraception, and then as time went on I did my supplementary prescribing and then my independent prescribing, and decided to do my masters in advanced practice, and having completed that, then obviously stepped into the role as an advanced practitioner. It's a very rewarding career. Primary care is very rewarding because you're seeing, it's not called general practice for nothing. It's a lot of conditions. To move on from being a senior nurse and move on into advanced practice is almost like a natural step. So there's a lot of scope within primary care for nurses, especially for those coming out from secondary care. It's a new role, it's a lot to learn, but very rewarding. I'm very lucky, very well supported by my GP colleagues, and I prescribe and treat from 0 to, I think our eldest is about 102, so across the age range. So it's a very interesting role. You become a generalist. You see anything from the new patient with high blood pressure. I do the anticoagulation monitoring, and I say monitoring, I run the service, so new patients with atrial fibrillation, of which we're getting to be an older population, we're seeing far more of them, will be referred to me by the doctors to actually come in and have a discussion about anticoagulation, so whether that's warfarin or one of the newer drugs, and we discuss it and explain the pros and cons, and all of the patients on anticoagulation of any description know that they can contact me if they've got any queries or concerns. So you can become more specialist in a particular area, but you're still a generalist, and yes, it's exciting. You don't know what's coming through the door.